Now, in the final section of complications of suppurative otitis media, we will talk about meningitis and lateral sinus thrombophlebitis. In this section, we will talk about the pathology and clinical features of meningitis and lateral sinus thrombophlebitis, how they are investigated, and what are the complications of meningitis and lateral sinus thrombophlebitis, and how they can be managed and treated. So first, the meningitis. We said this word so many times in our previous sections also, that meningitis is the inflammation of meninges with bacterial invasion of cerebrospinal fluid in subarachnoid space. So when the infection reaches the meninges, which are the coverings of the brain and spinal cord, it can cause meningitis. These are the meninges. Here you can see three meninges. There is pia mater, arachnoid mater, and dura mater. These are the three meninges, starting from inside out. Pia is the innermost, arachnoid is the middle, and dura is the outermost meninge. The mode of infection can be bloodborne and follow chronic ear disease, extradural abscess, or granulation tissue. So all these can lead to meningitis. It can be bloodborne as a result of ear disease or extradural abscess or granulation tissue. Clinical features. All these are the clinical features. Neck stiffness is very common. When you try to lift the head of the patient, the neck stiffness is so bad that you cannot bend the neck head or bring the head up. So neck stiffness is very common in meningitis. Headache, fever, vomiting, light sensitivity, drowsiness or confusion, joint pain, and fits or fitting. Clinical features, why these symptoms are present, signs and symptoms, is due to infection, due to raised intracranial tension or pressure is very important factor that leads to these complications. Raised intracranial pressure. Meningeal and cerebral irritation is also present. In examination, the common features, there is neck rigidity, there is positive Kernick sign. Kernick sign is straightening of the leg is hard because of the rigidity. Kernick sign, and Brudzinski's positive Brudzinski's sign. Here, when the head is lifted like this, there is bending of the legs. Tendon reflexes is also performed. Papilledema or swelling of the is seen inside on ophthalmoscopic examination. There is swelling in the eye, papilledema in pupils. Management is diagnosis, CT scan or MRI, lumbar puncture, and CSF examination. Treatment is antimicrobial therapy, corticosteroids, myringotomy or cortical mastoidectomy, and radical or modified mastoidectomy. All these treatments can be performed. Usually, meningitis has a good prognosis if treated early with antibiotics. So, lumbar puncture to diagnose meningitis is important. This is the position in which the lumbar puncture is performed, lying position and sitting position. Lumbar puncture is the procedure in which the CSF is removed. A long needle is used and then it is inserted between L3 and L4 and cerebrospinal fluid is removed, and then that cerebrospinal fluid is sent to the lab for the examination. Lateral sinus thrombophlebitis. Thrombo is formation of blood clot. Phlebitis is inflammation of the vein. Inflammation of inner wall of lateral venous sinus with formation of thrombus. So that's the sinus thrombophlebitis. Here you can see these are the different, this is the mural. Inflammation of the wall occur of the vein wall, and then this leads to formation of mural thrombus. This mural thrombus is small, attached to the wall. When it spreads or becomes bigger, it's called occluding thrombus, and this occluding thrombus become propagating thrombus, become bigger, and then there is in the thrombus there is abscess formation, and then as a result of this abscess formation, when this thrombus flows or cause occluding of the blood vessel, it can cause infection. Etiology is complication of acute coalescent mastoiditis, mastoiditis, chronic suppuration of middle ear, cholesteatoma. So all these are the factors that can lead to lateral sinus thrombophlebitis. Pathology, here you can see mural first, then occluding, and then central and breakdown to form abscess propagating. So first small mural thrombus, then become little bigger, cause occluding of the blood vessels, and then it becomes propagating, it start moving, there is formation of a central abscess that can cause infection. So formation of perisinus abscess, endophlebitis, and mural thrombus formation, obliteration of sinus lumen and intrasinus abscess. Then extension of thrombus. So pathology, how this occurs. First, there is abscess formation around the perisinus area. Then there is endophlebitis and mural thrombus formation, and then obliteration of that lumen, and then it causes extension of the thrombus. Bacteria usually that cause lateral sinus thrombophlebitis is acute infection is caused by hemolytic streptococcus, pneumococcus or staphylococcus. Then chronic infection is caused by Bacillus proteus, Pseudomonas pyocinius, and E. coli and staphylococci. So different bacteria that can cause infection is acute. It can be acute or chronic. Acute short-term, serious, chronic, long-term, less serious, and it can be acute is Streptococcus, pneumococcus, and staphylococcus. So cocci mainly cause acute infection. Chronic is by Bacillus proteus, Pseudomonas pyocinius, E. coli, and staphylococci. Clinical features. Here, clinical features is hectic, picket fence type fever with rigors, headache, progressive anemia and emaciation, Griesner's sign, papilledema, Tobey eye test, and this in Tobey eye test when the compression of internal jugular vein is compressed here in the neck, and this causes rise in pressure if it's normal. And when it's lateral sinus thrombophlebitis, clot is present, then there is no rise in pressure because of the obstruction of the vein as a result of thrombus. So it's important test when compression of internal jugular vein. If there is a thrombus, there is no rise in the pressure because it's occluded, but in normal person there is rise in the pressure. Then Crow back test, tenderness along jugular vein because of phlebitis. It's inflammation of the vein through, so there is pain and tenderness present in the jugular vein in which most of the veins come and drain. Then investigations, blood smear, blood culture, CSF examination, X-ray of the mastoids, imaging studies, culture and sensitivity. So different tests are done to find out the lateral sinus thrombophlebitis. Complications, septicemia. If you see, this is the picture of the patient with septicemia. When infection is present in the vein or if there is thrombophlebitis, it can spread to the whole body as a result of infection of the bloodstream, and this can cause septicemia, very, very serious condition. Usually recovery is not possible and so many antibiotics are tried, but a lot of patients, they cannot survive as a result of serious septicemia. So complications, septicemia and pyemic abscess in the lung, bone, joints or subcutaneous tissue, meningitis and subdural abscess, cerebellar abscess, thrombosis of jugular bulb and jugular vein with involvement of 9th, 10th and 11th cranial nerve, cavernous sinus thrombosis. All these are the complications of lateral sinus thrombophlebitis, septicemia, meningitis, cerebellar abscess, subdural abscess, cavernous sinus thrombosis, and this is the person which showing the petechial hemorrhages with septicemia. Otitic hydrocephalus also. Treatment is intravenous antimicrobial therapy. Anticoagulants are also given because septicemia is there. Septicemia leads to disseminated intravascular coagulation, so anticoagulant therapy is important. So mastoidectomy and exposure of sinus, ligation of internal jugular vein, anticoagulant therapy, supportive treatment is important. So all that is about the lateral sinus thrombosis and meningitis. So that was the end of our lecture topic, suppurative otitis media, complications, and we talked in detail about all the complications associated with suppurative otitis media. So thank you for watching sqadia.com.